Your cat is drinking more water than usual. They seem thinner than they did just a few months ago, and when you call their name, they barely lift their head from the blanket. You watch them sleep more than they used to. They used to greet you at the door. Now they just look at you with those tired eyes, and something in your gut tells you that time is slipping away faster than you want to admit. You've been to the vet, you've heard the words chronic kidney disease, and now you're sitting here maybe at 2 a.m. wondering if there's anything more you can do, wondering if you're doing enough, wondering if your cat is suffering. You've probably already spent money on prescriptions and specialty foods and supplements that promised the world and delivered very little. Maybe you've scrolled through forum after forum, reading contradictory advice from strangers, each one more confident than the last, until your head is spinning and your heart feels heavier than ever. And through all of it, one quiet fear keeps surfacing. What if I'm running out of time with this cat? But what if I told you that there are 4 specific, concrete, vet-approved things you can do right now, starting today, that have a real and measurable impact on how long and how well your cat lives with this disease? Not expensive procedures, not miracle cures. 4 steady, consistent actions that the research backs up and that I have seen change outcomes over and over again in my own practice. That is exactly what this video is about, and it is exactly what the thumbnail brought you here to find. Welcome back, my friends. I'm James Pohl, your neighborhood veterinarian, and I am so glad you're here with me today. I've been caring for cats and dogs for closing in on 40 years now. 40 years of exam rooms and late night phone calls and families sitting across from me in tears, asking the same question you're probably asking right now. Is there anything else we can do? And after all those years, the answer I've come to trust is almost always the same. Yes, there is almost always something more we can do. Not to cure, because chronic kidney disease does not have a cure, but to slow it down, to protect what's left, to give your cat more good days, more comfortable mornings, more slow afternoons in the sun. That is what holistic root cause care looks like. And that is what we're going to talk about today. I know so many of you have been with me through other health challenges with your animals. If your cat is also dealing with weight loss or changes in appetite alongside kidney disease, you might want to go back and watch my video on the warning signs of senior cat decline. It ties into everything we're covering here. But right now, I want you to grab a pen and something to write on, because this is a complete masterclass in managing feline chronic kidney disease at home. 4 steps, real science, plain language, and I promise you it is worth every minute of your time. If you haven't subscribed yet, please do it now before we go any further. This channel exists to help cats like yours live longer, and every subscriber tells the algorithm to put this information in front of more families who need it. Let's start at the beginning. Step 1 is hydration. And I want you to hear me when I say this, because it is the single most important and most overlooked factor in your cat's daily survival with this disease. The kidneys are not just filters, they are regulators. They manage the precise water balance inside every system of your cat's body, from digestion to circulation to how the cells of the gut lining function. When those kidneys are diseased, that regulation starts to break down. And dehydration becomes both a symptom and a cause of further damage, all at the same time. I want you to picture a grape and a raisin. One is plump, resilient, full of fluid, full of life. The other is shriveled, rigid, and struggling. Now, picture those 2 states inside your cat's body. Picture the cells lining the stomach and intestines when they are dry. Motility slows. Food stops moving through the way it should. Constipation sets in. Your cat feels nauseous. Appetite drops. Weight falls. And all of that creates a vicious cycle that accelerates the very disease you are trying to slow down. Dehydration also causes direct injury to kidney tissue. The kidney sits inside a capsule, a firm outer layer that does not stretch very much. When fluid levels drop, the organ essentially dries from within that capsule. At best, your cat has what we'd describe as the feline equivalent of a constant headache. At worst, We're adding new damage to an already compromised organ every single. Here's a quick test you can do right now. Go find the scruff of your cat's neck, that loose skin between the shoulder blades. Gently lift it with 2 fingers and let it go. In a well-hydrated cat, it snaps right back. In a dehydrated cat, it lingers. It tenses. It takes a moment to settle. This response can vary a little based on how much fat your cat carries, so learn your cat's normal. But if that tent is staying up longer than it used to, take note. You can also run your finger gently along your cat's gums. They should feel slippery, almost slick, like wet bubble gum. If they feel tacky or dry, your cat is telling you something important. So what do you do about it? You remove every barrier between your cat and water, and you add every incentive you can think of. A circulating water fountain is often the single best investment you will make for a kidney cat because the movement attracts cats instinctively. Place multiple water sources around the home, not just one bowl in one corner. Some cats are drawn to water with a single ice cube floating in it. Some cats respond to a few drops of low-sodium broth added to their water. Some cats, particularly in later stages of the disease, need subcutaneous fluid therapy administered at home or in the clinic, a technique I'll discuss more when we talk about working with your vet. Wet food, when your cat will eat it, is also a significant hydration tool because it carries moisture directly into the body. We'll come back to that in step 2. The key message here is this: hydration is not a passive thing you hope happens. It is an active, daily, creative effort, and it makes a difference you can measure. Step 2 is diet, and this one is both the most powerful tool in your kit and the most frustrating because cats are not cooperative patients when it comes to food changes. Let me lay out the science first, and then we'll talk strategy. Research consistently and clearly shows that cats with chronic kidney disease who eat a diet specifically formulated to reduce the workload on the kidneys live longer and they live better. That is not opinion. That is decades of peer-reviewed data. A kidney-friendly diet does several things at once. It contains lower phosphorus levels because phosphorus is one of the most significant drivers of kidney damage progression. It provides protein that is high quality but measured carefully. Because too much low-quality protein floods the system with waste products, the kidneys can no longer filter efficiently. It also typically contains lower sodium, added potassium, added omega-3 fatty acids, and adjusted fiber to support digestive health. Now, your cat may look at the kidney food you bring home with absolute contempt. I have seen it 1,000 times. And I want to be honest with you about something because I think honesty is more useful than optimism in this moment. A cat that refuses to eat any food at all is in more immediate danger than a cat eating a diet that isn't perfect. Long-term starvation causes a catastrophic liver condition in cats called hepatic lipidosis, and it progresses fast. So if your cat simply will not touch the kidney food, do not force a hunger strike. Eating something is always better than eating nothing, but it is worth a real fight before you surrender. Try warming the food gently to just below body temperature, somewhere around 100 degrees Fahrenheit, because heat releases aroma, and aroma is what drives a cat's appetite. Try a different texture. If your cat refuses pâté, try minced. If they refuse minced, try shredded. Try a different dish, a flat plate rather than a deep bowl, because some cats dislike their whiskers touching the sides. Try a slow transition, mixing just 10% of the new food into the old food for a week, then 20%, then 30%, moving slowly over the course of a month or more. And if none of that works, talk to your vet about appetite stimulants. I know the word medication can feel like a step backward, but a medication that allows your cat to eat the right food is not a defeat. It is a strategy. Stay with me here, my friends, because what comes next is the part that most cat owners never even think to ask about, and it may be the thing that changes everything for your cat. Step 3 is pain control, and this one surprises people. When I bring it up in the exam room, I often see a slight frown. My cat isn't limping, my cat seems okay, and here's what I tell them. Chronic pain in cats is almost never obvious. Cats evolved as both predator and prey. which means showing weakness was always dangerous. Their instinct is to hide discomfort, to compensate, to keep going until they simply can't anymore. So by the time you notice something is wrong, the pain has often been there for a long time. Cats with chronic kidney disease are frequently also dealing with arthritis, and the two conditions often arrive together in older animals. They may also have dental disease, which is a painful infection sitting inside the mouth day after day, or urinary stones causing discomfort every time they visit the litter box. Any one of these sources of chronic pain will do something specific and harmful. It will make your cat less willing to move, less willing to walk to the water bowl, less willing to walk to the food. It will reduce their intake of both, and it will quietly accelerate the weight loss and dehydration you are working so hard to prevent. Chronic pain also places a biological stress load on the body. Stress hormones circulate, inflammation increases, the immune system is perpetually activated. And all of that is work the kidneys are being asked to participate in while they are already struggling. The good news is that pain management in cats with kidney disease, while it requires careful selection of medications and approaches, is absolutely possible. Your vet will need to weigh your cat's specific kidney values before choosing an approach, because some anti-inflammatory medications that work well in healthy cats can increase stress on compromised kidneys. But there are options. There are newer pain medications specifically designed with kidney patients in mind. There are also adjunct therapies like laser therapy, which uses targeted light energy to reduce inflammation in joints and soft tissue. There is also pulsed electromagnetic field therapy, which is non-invasive and growing in evidence for managing feline arthritis. The point is to have the conversation. Tell your vet that you want to specifically evaluate your cat for pain and discuss every available option. A cat that is comfortable and mobile is a cat that drinks more, eats more, maintains weight better, and lives longer. Step 4 is infection control, and this one is quietly dramatic. I say quietly because the damage happens slowly, invisibly, in ways that often don't ring any alarm bells until the situation is already serious. The most common infection I want you to think about right now is in your cat's mouth. Dental disease. I cannot tell you how many times I have sat across from a loving, attentive owner, explained that their cat has significant dental disease, gone through the rest of the examination, and then watched that same owner say at the end, so they're pretty healthy overall, right? And I have to pause, because the answer is no. Dental disease is a bacterial infection. Tartar is a colony of bacteria sitting on and under the gum line, day after day, releasing inflammatory compounds into the surrounding tissue and sometimes directly into the bloodstream. That bacteria can travel, it can settle in the kidneys. And in a cat whose kidneys are already damaged and whose defenses are already compromised, a bacterial infection reaching that organ is a serious, serious event. Cats with chronic kidney disease are also more prone to urinary tract infections and kidney infections than healthy cats, simply because the tissue is more vulnerable and the immune response is operating under greater strain. These infections can be low-grade and silent for weeks before they cause visible symptoms. Regular urine screenings done as part of your monitoring routine catch these infections early when they are easiest to treat and before they cause significant new damage. So, step 4 is this. Do not put off dental care because you are afraid of anesthesia. Discuss your cat's specific kidney values with your vet. Ask what their protocol is for anesthesia in kidney patients, because there are real and effective ways to manage that risk. An untreated infection is often a far greater danger than a carefully managed dental procedure. And ask for regular urine monitoring as part of your standard care routine. Now, let me talk to you about something that gets a lot of people in trouble, and that is doing too much too fast. I hear from owners who have read everything, who have bought every supplement, who have changed the food and added the fountain and started the joint support all in the same week. And then they write to me because their cat is vomiting and refusing to eat and they don't know what went wrong. The answer is usually that they overwhelmed the system. Your cat's gut and kidneys need consistency. They need gradual change. Pick one thing from this list to work on first. Hydration is almost always the right place to start because it is the most immediate need and the one with the fastest visible impact. Work on that for 2 weeks. Observe your cat. Then layer in the diet transition slowly, patiently. Then bring pain assessment to your vet. Then build your infection monitoring routine. 1 step, 2 weeks of attention. Then the next step. But James, is it really that simple? I've read that you need to do all of these things simultaneously or they don't work. Well, my friend, after nearly 40 years in this field, what I can tell you is that consistency beats intensity every single time. A cat who is calmly and steadily managed on 2 or 3 of these pillars will do better than a cat whose owner tried everything at once and burned out in the first month. You are in this for the long run. Pace yourself. Now, I want to be honest with you about something because the trust between us depends on it. Home care and lifestyle management are powerful. They are genuinely, measurably powerful. But they are not replacements for professional monitoring. Chronic kidney disease requires regular blood work, typically every 3 to 6 months, depending on the stage your cat is in. It requires urine analysis. It requires blood pressure measurement because kidney disease and high blood pressure are deeply connected, and uncontrolled hypertension causes its own cascade of damage to the eyes, the brain, and the heart. And it requires a physical examination because there is information in laying hands on a cat that no lab test can give you. If your cat suddenly stops eating entirely, if they are vomiting multiple times in a day, if they become unsteady on their feet, if they stop using the litter box or produce almost no urine, if their gums turn pale or gray, these are not situations for a home remedy. These are situations for your vet today or for an emergency clinic tonight. Please know those red lines. Draw them clearly in your mind. My friends, if you have watched this far, I need you to hear something. The fact that you are here, learning, asking questions, looking for more ways to help your cat, that is not a small thing. That is love in action. That is you being the kind of pet parent that makes a genuine difference in an animal's life. Your cat does not know about kidney disease. Your cat just knows you. Your cat knows your voice and your smell and the warmth of your hands. And the care you are learning to give them right now, the hydration strategy, the careful diet, the pain assessment, the infection monitoring, that is how love shows up in practical, life-extending form. You don't have to be perfect. I want to say that again. You do not have to be perfect. Even small, consistent actions done with love and attention have real power to change the trajectory of this disease. The cat in your lap right now is lucky, genuinely lucky. And I hope you take a moment tonight to feel good about that. If this video helped you, please hit the like button now. I mean that sincerely, not just as a ritual request. When you like this video, you are telling the algorithm that this kind of honest, holistic, veterinarian-backed information deserves to reach more families who are sitting right where you were sitting at the start of this video. You are helping protect cats you will never meet. That matters. Subscribe if you haven't already, because we have so much more coming on senior cat care, kidney disease management, and natural approaches to keeping your animals healthy longer. And I have a specific question I want you to answer in the comments right now. Tell me your cat's name, their age, and what stage of kidney disease they've been diagnosed with, if you know it. I read these. Your cat's story matters to me personally, and I want to know it. This is James Pohl, your neighborhood veterinarian, signing off for today. Tonight, when you go to your cat, wherever they're resting, give them a slow, gentle scratch behind the ears for me. Just one quiet moment of connection. That's everything. Stay safe out there, my friends, and always, always trust your instincts. You know your cat better than anyone.